noticed that she felt a little uncomfortable, especially when we kind of brought it up in the patient's room and we kind of put her on this pedestal and made her feel other, perceived in a way that maybe she wasn't quite ready for.
Well, I wanted to make sure that she knew how much I appreciated all the work she's putting in with her hair. She's been an intern here for 6 months now.
In the training today, I played the role of an attending that was very positive and very interactive with both students and interns and patients, but would occasionally make comments that were more so geared toward physical attributes of, interns and residents, and giving feedback that was, for the most part, unsolicited.
Beyond what they're doing just with medicine, because we all know that they're great interns, and I don't need to tell them about that.
Yeah.
There's a lot of barriers that we face whenever we're bringing up something that may be uncomfortable of, saying you think somebody may be doing something in a way that's ineffective or something that may just be harmful. And so by learning these methods of asking open-ended questions, going into things not judgmentally, really equips you to have some groundwork and some pathway whenever you're having these uncomfortable conversations.
In the real life example, how our kind of role player Neil played it is they did talk to Simone first and shared with them their concern. And the real life Neil said, if you don't mind, I am actually going to say something because I am concerned that this could happen to others, and it's just not okay.
I think that all of these trainings that we do and all of these extra steps we take will make us great physicians and great residents. It's a team-based system. And whenever you have a graduate from this school, you know that person will go in and will work to create a culture that's centered on patients and centered on that positive and effective communication. And I think that goes a long way.
Neil, you give me a lot to think about here.
Okay.
And maybe I'll consult with some squads and some teams and learn some ways to help fix that behavior.
Fair enough.
Let's give them a golf clap here.